welcome back to Newark Today. I'm Michael Hill. In our second half hour here, we have a lot to talk about in terms of Alzheimer's and what Rutgers University-Newark is doing about that, and some of the research it's doing. I'm joined in studio here by Glenda Wright and also Delores Hammonds, and we're going to talk about what they're doing in terms of outreach in the city of Newark, in the county of Essex, and in this area, about reaching out to folks and trying to get them involved and participate in this study we're going to talk about with Dr. Mark Gluck. We want you to participate in this conversation as well. The number to call is 973-297-0941. That's 973-297-0941. And Glenda, Delores, welcome to Newark Today on WBGO. Thank you for coming in this evening.
You're
Thank
welcome.
you. Thank you for having us, Mr. Hill.
Michael, please. I'm very excited to talk to you about the work that you know. I've spoken to you on the phone, and I want to talk to you about the outreach that you're doing. You are working with Dr. Mark Gluck. He's a professor of neuroscience and public health at Newark, Rutgers. He directs the Aging and Brain Alliance program there, so we want to talk about that as well. He is just returning from the Alzheimer's Association's International Conference in Amsterdam, and I spoke to him before he went to Amsterdam about the research that he's doing, this national study of familiar-based Alzheimer's diseases study when you see clusters of a disease in a family. And this is important because this disease affects so many people, as Dr. Gluck and as you know.
Yes.
And Dr. Gluck explains that not a lot of research has been done in this area. I'm going to go ahead and play now. This is the first part of my conversation with Dr. Gluck.
Here at Rutgers Newark, we're part of a national study on familial-based Alzheimer's disease. So we're particularly interested in working with collaborators, partners around the country at families that have multiple incidences of people who have dementia. So a parent, a sibling, a cousin, an uncle, because when you see a cluster of people within a family, a cluster of blood relatives who have Alzheimer's disease, it suggests that there's in particular genetic reason for this, that this family, they carry a gene that increases their risk for Alzheimer's disease. And we know a lot about the genes for Alzheimer's disease in those of European descent. We don't know nearly as much about the genes for Alzheimer's disease in those of African ancestry.
And so your study hopes to get to the bottom of that to determine if the genes are the same or if they are different?
Right. Well, we know that for late onset Alzheimer's disease, so Alzheimer's that starts in the 70s and 80s and above, that the genetics of Alzheimer's differs by race, that the genes that impact Alzheimer's risk in those of Asian ancestry, African ancestry, and European ancestry are all slightly different. There's overlap, there's commonality, but there are clear differences in which genes are important in one race versus another. And so we expect that the same may well be true for the genetics of Alzheimer's that occurs in families where the Alzheimer's tends to happen early in life.
Has there been much research in this regard in terms of African Americans and trying to get to the bottom of early onset, where it's common in the family that people in their 50s, early 50s in some cases, or even their early 60s develop Alzheimer's?
There hasn't been as much work because there hasn't overall been much participation by African Americans or outreach to African Americans across the country at Alzheimer's centers. So at Rutgers University-Newark, we've built a major center for the study of aging and brain health and Alzheimer's in African Americans. And we use that base of focusing on African Americans to enhance our understanding of all aspects of Alzheimer's risk in people of African ancestry.
And so in this particular case for this study, what are you doing in terms of outreach, and what do you want from the people you do reach? How do you want them to participate?
So our outreach programs are quite extensive in Newark. We've been working in the community, in the Black community in Newark and surrounding areas for about 17 years. And we work with churches, we work with the mosques, we work with alumni associations, public housing, a broad range of community organizations, faith-based organizations. all the various organizations and groups that are involved in the Black community in Newark and in East Orange and the surrounding area. And what we're doing is we're reaching out and we're trying to identify families that have multiple cases of Alzheimer's and across multiple dimensions. It can be siblings, parents, and so forth. And we bring them in. We do some basic testing about memory and family history. And a critical part is we get genetics, either from saliva or if people are willing, we can get the genetics from blood. And this allows us to understand what it is that may be common among many members of the family that may be part of the clue to why this family has a high incidence of Alzheimer's disease.
Doctor, give us a sense of that outreach and what the results have been. Are you getting a good response in terms of participation?
We've enrolled, in terms of all of our studies, not just this family study, we've enrolled over 500 older African Americans ages 60 and above into our various studies of aging and brain health at Rutgers Newark. So we have a very large community outreach program. Most of our community programs are focused on community needs. We do health education. We provide opportunities for learning how to improve fitness, how to improve sleep. So most of our work in the community is based on finding ways in which we can help the community help themselves reduce dementia. And then through this community engagement, through providing educational and brain health support programs in the community, we can tell people about our research and give them an opportunity to help fight back against Alzheimer's disease.
And back in the studio here with Glenda Wright and Delores Thornton Hammonds, when we start talking about outreach, you are the front line for outreach for this program. Glenda, tell us, what do you do? What exactly does that outreach look like?
Well, from the beginning, when I first met Dr. Gluck, and I was reading some information about Alzheimer's disease, and when I was told that African Americans are 2.5 more times likely to get Alzheimer's than any other ethnic group, I was just stunned. I could not believe it, and that helped me to become a part, or it forced me to become a part of this undertaking. Right now, what I do with Rutgers, I am the outreach community engagement person. And I go around to the community talking to mostly seniors that are 60 and over in reference to minimizing our risk of Alzheimer's disease. And we have to make sure that we exercise regularly. We have to challenge our brain. We must manage our stress. We must get a good night's sleep. We must socialize with others and eat a healthy diet. These are the major factors that how we can reduce our risk in Alzheimer's disease. And that has been proven through the data that Rutgers have collected from all of our participants.
And Delores, let me ask, when you share this message with participants, with people, potential participants, and others at community organizations and churches, what's the response? What do people say?
First, they be afraid to do it. But then I have that knack of getting them to do it. It's the way I approach them and the things that I say to them.
Give me an idea what you say.
I tell them how, when they tell me nobody in my family have it, first thing I tell them, they don't know whether someone in their family have it or not, because they don't know all their relatives. So that helps. And when I start talking to them about how they can help themselves by exercising, as Glenda had said, and eating correctly. And I tell them, instead of going to the fast food places, go home and cook, fix you something to eat. But the main thing is, I think they're afraid. But then I tell them, don't be afraid, because it's something that we need to do. Because if we don't do it, it's not going to get done. You can't go to your doctor and tell your doctor, oh, I have a headache. I misplaced something and I can't find it. That don't mean that you have dementia. And doctor's not going to say, okay, I'm going to send you to a clinician to be evaluated. They'll tell them to take a pill, and the pill's not going to help them. They need to go and get themselves evaluated to see what's going on. And we down at Rutgers, that's what we do. We evaluate them to see if there's anything, if there's anything
Once
there.
they come in.
Yes. We first thing they do is the blood work, and that's down at 90 Bergen Street,
Yes.
the blood work and the saliva. Then they go in for the longitude testing, which consists of memory. Then they do the MRI. So these are things that you can find out if there's something wrong. And if it is, we send them to a clinician to be evaluated.
Good. And Delores, let me ask you this. I'm listening as you're talking about people coming in and being evaluated. And when folks hear this kind of thing, oh, that's going to cost me. So, what does it cost?
I let them know straight up. I don't want to see no insurance card. The only thing I want to see from you is your COVID card, because you have to be COVID.
Right.
So there's no insurance, and I let them know that straight up. We pay you. You don't pay us.
Well, you do.
Yes. So I let them know that. And all it takes from you is a little bitty time to say, yeah, I'm going to be evaluated to see if there's anything going on. I myself don't know anyone in my family that have it, but don't mean nobody don't have it.
Right.
I also let them know about glaucoma, which is hereditary also. I have it, and I let them know that I have it. And nobody in my family have it, but somebody somewhere down the line had it in order for me to have it.
Right. Glenda, do you know of anybody in your family who has Alzheimer's?
Well, I have a sister that she does have early onset dementia or Alzheimer's disease. And there's always a burning question in all of our minds. If a family member have it, the first thing we ask ourselves, will I get it?
Right.
And to be honest, you don't want it. So whatever I can do to minimize my risk, that I'm going to do. And this is why I'm so adamant about getting out in the community, encouraging people to join Rutgers with this program. We're not a Tuskegee experiment. We're not a Henrietta Leaks experiment. We're just out here trying to make people aware of this dreadful disease, which strikes us more than any other ethnic group.
Do people, when you cite those statistics, do people say, wow, I didn't know that?
That was my first thought. I was taken aback. I did not know that our stats were that high with Alzheimer's disease. So again, whatever it takes for me to minimize my risk and anyone else that I can reach, that I'm going to do.
Now, do they call the center to make an appointment to come in? Because I see the number on the Alliance's website. Is it the 973-353-3673 number to call to participate?
Some call.
Okay.
Some, when Glenda go out and do her presentations, they fill out cards,
Okay.
and I call them.
Right.
And I have long conversations with them. And even when they come down for the blood work and they have to sign a consent form, I go over the whole consent form with them. And when I finish, I ask, do they have any questions? And even doing the consent form, do you have any questions? Some have questions and some don't. And I am so grateful that the questions that they ask today, I can answer it. Once upon a time, probably I couldn't. I would have had to call the lab to ask. But now I can, because like it's a dementia, it's a very ugly disease. And this is what I say to them. And nobody wants to get it. And nobody knows too if they have it, because it can be in your body 5, 10, 15, 20 years and never know that you have it, when all of a sudden there it is. And people don't realize that. So we're here to teach them what they need to do, what they should do, what they need to do. And exercising and eating correctly is one of the most important things that you can do. Sleep. We need to get sleep. And that's something that we just don't do. We don't get enough sleep. And it's not because there's guns going off outside or something. We just don't. Stressing, we got to eliminate that. And I know Glenda talk about it, and so do I when we're doing a presentation of things that you need to stop doing.
Right.
And
No, go ahead.
there's so many like socioeconomic factors though that we're at risk of, even living in substandard housing, the environment we live in. There's so many factors
That's trauma.
All of this has a bearing, I do believe, with Alzheimer's disease. When I'm doing my workshops at senior sites, they're very attentive when I begin to talk to them about how we can change our lifestyles. And one thing I stress to the senior population, it doesn't matter how old you are, there's always room for change. If there's something that's going to help you minimize your risk, please don't say, well, I'm too old to change. No, you're not.
Right. I called Dr. Gluck after Rutgers came out with an article a couple of months ago, and reached out to him after I read the article, because in my family, and for the record, I want to be clear about this, in my family, relatives are going to participate in this study because the prevalence of Alzheimer's in my family is just, when I say my family, my in-laws' family, is just extraordinary from generation to generation. And we're dealing with that right now in my very own family. And so we have a daughter who is terrified of this disease because she's seen it. My wife and I take care of my wife's parents who had it. And there are other relatives right now recently diagnosed. There's one in Texas who is on a home hospice because he's on in the latter stages of it. So I know how serious a disease this is, and I've seen it in this family from one generation to the next. Over the years, I have talked to different researchers who are doing the kind of work that Dr. Gluck is doing with this national study, and mentioned to them about my in-laws' family. And most of the time, the response I've gotten was, oh, wow, that's really something. Dr. Gluck is the first one that said, I want your family to participate in this study. And so here we are. I want to play another segment here of Dr. Gluck talking about some other things with this study. And in this segment, the doctor's going to also talk about an event that took place last month the gala that took place in Rutgers, where I saw some of the.
It was wonderful.
It was incredible.
Yes, it was.
It was great,
and the community enjoyed it.
Oh, it was. I'd never seen anything like that before. Never seen anything like that before. And it was a conference there. It was a conference where, let me explain, it was a conference that had researchers from across the country, but it also showed in real life what another component of this alliance and this program, which is getting people involved, elderly people up, moving about, talking, socializing, which you say is so important to help prevent this disease. Here's more of my interview with Dr. Gluck before he went to Amsterdam for the international conference.
Once there's a family that has now, or maybe had a history, there may have been a parent who had dementia and passed away, an uncle, a sibling. We want to get all the members of the family, those who are young, those who are old, those who have dementia, and those who don't, all to participate in the study, or as many of them as are willing, so that we can compare the genetics of those in the family with dementia and those without dementia, so we can help zero in on what are the genetics of Alzheimer's that runs through that family.
And doctor, what's the overall goal here? To know what?
The overall goal is twofold. Partly it is to understand the mechanisms of Alzheimer's, especially the genetic components of that, because once we understand the genetics of Alzheimer's, then we can do two things. One is we can identify early on people who are at high risk and then develop interventions that can help them before they get dementia. Because right now, most treatments for Alzheimer's, or all treatments for Alzheimer's, wait until somebody already has Alzheimer's disease and then tries to provide a cure. And the problem is, by the time someone is showing the signs of Alzheimer's disease, the dementia, the loss of cognition and memory, they're about 80% of the way through the disease. So what we call Alzheimer's disease might be better thought of stage 4 Alzheimer's disease, when stage 1 to 3 is the part that's happening silently below the surface. And we know now that we need to get in at stage 1, maybe 5, 10, or 15 years before the dementia and the memory problems begin. So understanding the genetics, one big thing is to help us identify people early on who might be likely. The other is, once we understand the genetics, we can ask, what does that gene do? How does it affect different parts of the body and the brain? And then can we develop interventions that are specific? And there's a broad trend in medicine, not just in neurology or psychiatry, but throughout medicine, called personalized medicine. And what personalized medicine means is that it's medicine that's specific, or treatments that are specific to somebody's genetics. So you don't just treat someone because they have certain symptoms. You say, because you have these symptoms and you have this gene, we'll try this drug. But if you have the same symptoms, but a different gene, we'll try another drug. And so we understand now that many different treatments, many drugs or other treatments, work differently depending on somebody's genetics. And so understanding the genetics in African Americans will give us the opportunity to apply that future treatments personalized to those of African ancestry who have particular risk genes. And that's really sort of the direction of all of medicine, is this personalized medicine where the treatments are specific to the genetics.
Doctor, I'm curious. I asked you this some time ago, and I was just curious because you're so steeped in this field. And my question was, how do you prevent Alzheimer's? Say in your study, it's determined that someone who's 37, 38 years old is showing no signs right now, but has a mom or a dad who is in the early stages or has been diagnosed as early onset Alzheimer's. What do you say to that 37, 38-year-old who may have the gene and it's determined that a person has the gene? What do you say to them about prevention? What should they do?
Well, the good news is that overall, about half of the risk for Alzheimer's comes not from genetics, but from one's own health and lifestyle behaviors. And so what we say to somebody from a family like that, or anyone, is that you have the power to change your health behaviors, and in particular to increase your rate of exercise, particularly aerobic exercise, the kind that gets your heart rate increased, to improve the quality of your sleep, to reduce unnecessary stress. These are three of the things that are probably most important that you can try to manage. So exercise, sleep, and stress. And if you do that, you can reduce your risk of Alzheimer's disease. You can't necessarily prevent it. It's not a cure-all, but it reduces your risk. And so I would say the same thing to someone from a family like this that I would say to just about anyone, is that to adopt brain healthy and also heart healthy behaviors, such as improved exercise, sleep, and stress reduction.
Doctor, I've seen your program in action. It's not just on the medical side, but it's on what I would call the social activity side. The dinner you held last month at the national convention, national conference that you had in Newark, I saw members of church groups with fancy hats and dancing and moving and, I mean, living it up.
They were, and many of those women and men who were performing at our national conference last week were themselves participants in our research studies. So a big part of our commitment to the community is not only to do everything we can to help the people in the community reduce their risk for Alzheimer's, to improve their sleep, to improve their exercise, but also to share with them the data, the results that we get from their participation. So part of what was going on last week at that conference was celebrating all that we've learned from the community by sharing that knowledge back with the community.
Mm-hmm. That's Dr. Mark Gluck, there, professor of neuroscience and public health at Rutgers, University-Newark. He directs the Aging and Brain Health Alliance at Newark and is asking people who have dementia, Alzheimer's in their family line to take part in this national study that Rutgers is conducting. And in the studio with us once again, Glenda Wright and Delores Hammonds, Thornton Hammonds, talking about their involvement in getting people involved in the study and reaching out to folks. And Delores, I want to go back to something you said. You said the program pays for people to come in?
Yes.
How much does it pay?
It's $50 for each thing that they do, which is the saliva and blood. That's the first thing. And then they do the longitude testing. That's the $50. Then they do the MRI. Plus they do pay for transportation. So it doesn't cost anything just to be in the study. We pay you. And like I said, it's nothing to do with your insurance. And I'm the first person that they see because I'm there to do the blood work and the saliva. And the only thing I want from them or ask them to bring to me is a list of their medication. If I don't be done, got them all. And their COVID vaccination card. Those are the things I need. I don't want to know your ID. I don't want to hear about no insurance. That has nothing to do with it. We don't take that. We just want to take care of the people to make sure that they're okay. And this is what we're doing. We also starting up a dementia support group.
Right.
Something that's is dear to me because when I met Dr. Gluck, I was doing grief support. And I told him about it. So I'm starting out a dementia support group, which is something we really need because we can help each other that is going through dementia with someone that we're taking care of, just like we do in the grief support. And doing my grief support, I talk about dementia too. And the people that's there be very interested in it. And some of them that come is participants. And I tried my best when Glenda do the bring the peoples in, bring the cards in. I try my best to get them to come in. Some say no, I'm not interested, but me and my talking to them has gotten people to come on in. I mean, this is what I do, and it's something I love doing. I love working with people, and I love what I do. I love working down there with Mark and everybody because I learn a lot from being there.
Glenda, when you go out and you during your workshops and so forth, and you're talking to people about this study and about lifestyles and so forth, what do you say to yourself when you know you can look at someone and what you're saying, that message resonates, and you get someone to participate in this study and to come in and say, look, I want to know, I want to help?
I feel exhilarated. I mean, I feel really good because they care about themselves, especially when they sign up to participate. And I commend Dr. Gluck and Rutgers for having such an extraordinary program because there's no other school or facility in the Essex County area that have the caring, to introduce Alzheimer's to the population. We have over 500 participants, and Mike, I can truthfully say most of 99.9 of the participants, they enjoy it. They tell others about it because they want to know. It's just a wonderful, it's a voluntary program. I stress that at my workshops. I let them know it's a voluntary program, but still, in my conclusion, when I'm doing the workshops and if they want to sign up, if I have 35 participants in my workshop, I can guarantee you 30 sign up for the participation.
That's fantastic.
They do. It's just it is, I'm in awe of this program because it has helped me. I want to live, and so does everyone else. So that's my goal, is to live healthy.
And we have people that come.
We have to leave it there. I'm sorry. I want to thank Glenda Wright and Delores Thornton Hammonds for coming in, talking about what's taking place at Rutgers-Newark, which is trying to get African Americans in to participate in this Alzheimer's study. And you can certainly contact the Aging and Brain Health Alliance at Rutgers-Newark and Dr. Mark Gluck. I'd like to thank him as well. Thanking the team here too. Anthony Nieves, the board operator, Ken Downey Jr., screener, Jamara Wakefield, social media coordinator, Ang Santos, producer, Doug Doyle, executive producer, and I'm your host, Michael Hill. This is WBGO Newark.
Thank you, Mr. Hill.